Here are the top 10 worst exercises for trying to heal an ACL tear without surgery. The first exercise is quad contractions. Now let me just give you some details on this exercise. It looks like this. You have your leg resting somewhere and then you're trying to tighten up your quads, and as a result of that you'll straighten out your knee. The problem with this exercise is it's commonly done as an ACL rehabilitation exercise after surgery. But if you haven't had surgery and you're trying to avoid surgery, chances are you probably don't need to do this exercise because you probably don't have quads that are shut down. When you have a surgical procedure to your knee, there's a high probability that in the first couple of weeks after the surgery, your quads might not work too well. And so that's when you should be doing some quad set exercises, quad contraction exercises. But if you haven't had surgery, no need. This is not a good idea. Number 2 is leg extensions. This is the exercise where you sit down on a machine usually, and there's a pad or a bar that goes in front of your shins, your lower legs, and then you're pushing your legs straight like this against the bar or the pad, and you're trying to get those quads to engage and tighten up and get stronger. It's the same concept as number 1, so you don't need to be working out your quads too much if you haven't had a surgery. Usually the root problem that sets up an ACL tear that causes it to get weaker over time, and then you might have an accident or take that bad step that causes you to tear your ACL, it's rooted in a quad dominance problem. It's called a muscle imbalance. And so it doesn't make sense to get stronger quads. That's just what everybody says out there because they're thinking surgery. They're thinking that you had surgery. Number 3 is a leg press. Now this is a machine in the gym where you'll sit down and there's a pad in front of you or a big plate. You'll put weights on the sides of it or on top of it, and then you press your legs out like this. And the reason why I don't like this exercise, I think it's actually going to worsen your situation, is because it makes you work out your quads. The fact that you're in a seated position does not allow you to extend your hip this way, which takes your glutes out of it. Glutes are very important to be using when you're trying to recover from an ACL tear. And if you're focusing on only working out your quads or mainly working out your quads, then you're actually going to be feeding into the muscle imbalance that adds more tension to your ACL and doesn't allow it to heal properly if you're trying to heal without surgery. As a quick side note, I need to let you know that I've got a program where I put my whole treatment approach on how to fix the root muscle imbalance that sets up an ACL tear, as well as how to get your ACL in a position to heal if you've torn it. It's called the ACL Tear Recovery Program, and you can learn more about it in the description below. There's a link to the ACL Tear Recovery Program, and I've also linked a playlist of all our ACL Tear Help videos. It's called the ACL Tear Help Playlist. That way you can find all our videos. We have over 20. We're going to be adding more to the library as time goes on. Go check that out in the description below. All right, number 4 is heel slides. The way this one works is you usually have your shoe off, you're barefoot or in a sock, and you're sliding your heel towards you and away from you. And the goal here is to maintain or gain range of motion in your knee. The reason why I don't like this exercise is because if you have full range of motion or pretty close to it, if you're 90% or better on your range of motion, then you usually don't need to be doing this exercise. A lot of people that are trying to heal from an ACL tear, they'll find this exercise on the internet, or maybe they're told by another healthcare professional who doesn't really specialize in helping people heal naturally and avoid surgery when it comes to ACL tears. And they'll tell them to do this exercise not knowing that it's not the best thing. It's not necessarily harmful, but it's kind of a waste of time. There's other things you should be working on to make sure that your ACL heals naturally, and this is just taking up time that isn't going to be that productive for you. Number 5 is ankle pumps. And the way this one works is you're just moving your feet up and down like this and pumping your ankles like you would pump a pedal, like if you're driving a vehicle, like you're stepping on the gas. You'll even be told by healthcare professionals, step on the gas pedal, step on the brake pedal, step on the clutch, that kind of thing. And the idea here is to get blood flow through your calf muscle. And if you've had a surgery, it's actually very important because one of the risks of having an ACL surgery is getting a blood clot in your lower leg, in your calf muscle. And so doing these ankle pumps is beneficial to get the blood flow, to get the circulation so that you don't begin to form a clot from not moving too much, from not moving enough. But if you haven't had a surgery, then your risk of getting a clot in your leg is 0 to nothing as long as you're decently healthy. And chances are you're probably active to some degree. If you had an ACL tear, it tends to happen to more active people. So there's no need to be doing ankle pumps. I don't tell people that it's going to hurt you ever, but what I do say is it's just not the best use of your time. If you're stiffing your ankles, if you want to do this just because it feels good, cool. But if you're doing this with the intent of helping your ACL heal, it's not going to give you that much of a difference. It's not a big benefit for you. Number 6 is straight leg raises. This is a very classic exercise that you'll see in physical therapy clinics and on the internet when it comes to rehabilitation for any leg, knee, hip problem. It looks like this. You lie down on your back and then you're keeping your leg straight and you're raising it up. It sounds exactly like what it's called, a straight leg raise. When you're doing this, you're keeping your knee straight, which means you have to have your quad very active. And one of those quad muscles, the one that runs right down the middle, is called the rectus femoris muscle. It's the quad muscle that attaches right in the middle of the kneecap, and it comes up past your hip joint and attaches at the bony part of your hip right here. That muscle is a hip flexor by default because it crosses the front of the hip joint, so it's in a position where it can bend your hip. When you're doing straight leg raises, it makes you use your quads quite a bit. And the muscle imbalance that sets up an ACL tear is when there's a quad dominance and usually a glute weakness. So it doesn't make sense to be doing something that really gets your quads working and tires them out and even gets them stronger, because you're going to be making that muscle imbalance even worse. I go into a lot of detail on that in our ACL tear recovery program. Number 7 is wall squats. This one's commonly done by people that are rehabilitating after pretty much any knee injury, but I see it often after an ACL injury, especially after a reconstruction surgery on the ACL. It looks just like this. You're leaning on the wall and you're usually holding this position, and the idea is to get these quad muscles to burn, just like all the other quad exercises we did earlier. Not good because you're feeding into the muscle imbalance, and it's going to eventually put more tension on your ACL. The way that works, by the way, is when you're getting these muscles stronger, you tend to use them to stabilize, and it adds more compression to the knee, which forces the knee to move in a way that adds more tension to your ACL gradually, and it weakens it over time. So this is what sets up the possibility that you'll tear it. You just need a bad fall, somebody to fall into you, or a bad landing from a jump, some activity that just pushes you over the edge and tears your ACL, but it's set up by strengthening your quads too much. You'll see variations of this, like where people put a big stability ball or a yoga ball and they're moving up and down, or they'll slide up and down the wall. All of it strengthens your quads in a way that is not helpful if you're trying to avoid ACL surgery. Number 8 is balancing on one leg. So they'll have you do this sometimes, or in physical therapy, and this is good after surgery because your knee just went through an operation and it has to relearn how to work like a knee. But if you haven't had surgery and you're trying to avoid it, you just tore the ACL. You didn't injure any other part of the knee, hopefully. And so your balance should be decent. It should be okay. And it's actually going to be more beneficial for you to work on strengthening other muscles, other key muscles. The glutes are a very important one to be strengthening if you've had an ACL tear. And so balancing on one leg isn't very much a strengthening exercise. It's more a balance exercise. You're better off spending your time working on direct strengthening exercises rather than on balance exercises. There's been some research in the medical field on how balance can improve knee pain, but in practice, in actual practice, I've helped tons of patients with this. Spending time on balancing exercises is way less productive than spending time on strengthening exercises, because if you get stronger, your balance will improve nearly always. The last 2 that I have for you here are going to be shockers because I'm going against what a lot of the medical field says. Number 9 is walking. Walking for exercise is not a good idea if you haven't trained yourself on how to use the right muscles when you're walking. If you had an ACL tear, then you probably have an imbalance where the quads are too strong, and your tendency is going to be to use those quads every time you take a step when you're walking. So if you go exercise and walk when you exercise, like if you get on a treadmill for 20 minutes, or if you go walk out of the park, outdoor, if you walk anywhere with the intention of I'm exercising to help my knee to heal from an ACL tear, and your quads are doing most of the work, your quads are getting tired, it is not helping you. You're actually feeding into the imbalance, and you're setting yourself up to keep your ACL injured or re-injure it later on. And number 10 is cycling. This one is huge because it is difficult to not use your quads while cycling. Usually when you're on a bicycle, whether it's a stationary bike indoors or you're on an outdoor bike on the road, mountain bike, road bike, doesn't matter. Any kind of bicycle, recumbent bike with a backrest, any bicycle out there, you have to be very conscious to use your glutes, your butt muscles when you're pushing the pedal downwards. In order to get the pedal to go down, you have to use this muscle back here. If you do not use the glute muscle, by default, you're going to be using the quad muscle, which feeds into the imbalance. Now, it doesn't hurt you right away. Typically, people will go through rehabilitation after an ACL tear and be walking and be using a bike, and they'll heal. But what you're doing along the way is you're teaching your body to continue to use your quads, and it sets up people for the re-injury later on. I see this happen all the time.